Aspiration of stomach contents is one of the dreadful, but of course, a rare complication of anesthesia or sedation. So, in order to prevent or minimize this risk of complication, we have fasting protocol that patient has to follow and be compliant. There are various international protocols having the same aim but small variation. So, in this topic, I will be discussing important guidelines by various anesthesiologist societies. And in the last, I will put Indian Society of Anesthesia recommendation and, of course, the take home message. Hi, my name is Dr. Munir Jan. I'm anesthesiologist and critical care specialist. So, let's begin. So before understanding fasting guidelines of International Anesthesia Society, so let's begin with our first slide to understand what is clear liquid. Now this is the list what you can see. Apart from water, coconut water is clear liquid, black tea, black coffee, green tea, dextrose 25%, juices without pulp, these are considered as the clear liquid. And more important, aerated cold drink and Tetra Pak juices also considered as clear liquid. Now, non-clear liquid, mostly milk containing products like you have coffee with milk, tea with milk, smoothies, milkshakes. These are all considered as non-clear liquids. Now, light meal, bread slice, even though it's only a one slice, it's considered as light meal. Curd rice, 150 gram. It's mentioned in Indian Society of Anesthesiology. Curd rice 150 is light meal, and milkshake with fruit, you can see 200 ml only, is considered as light meal. So the other is the heavy meal. In the Indian context, we have this thali where we have chapati, rice, dal plus veggies. It's considered as heavy meal. Chicken curry and rice, one bowl, also considered as the heavy meal. Kebab with chutney, heavy meal. Pizza, even though you have taken only 2 triangles of pizza with coke, it's considered as heavy meal. Burger, only one piece, whether non-veg or vegetarian, it is heavy meal. Now, first recommendation, American Society of Anesthesiologists, fasting requirement at the time of induction. So they have clearly mentioned 2 hours for clear liquid excluding alcohol. Now, why alcohol? Because several studies have proven that alcohol's delays gastric emptying, and more important, it decreases the small intestine motility. So by that, there will be high chances of that it may remain in the stomach for prolonged period. 4 hours for breast milk, 6 hours for non-human milk, formula and light meal. 8 hours or more for fatty meal, fried food and meat. Chewing gum allowed up to until induction. So they consider chewing gum, it cannot lead to risk of aspiration, although there has been study where one group was allowed to take chewing gum and other group was not allowed. They had a regular fasting protocol, but yes, it has been seen at the end both the groups have same gastric volume at the time of induction. So they allow chewing gum up to until induction. Now their comments regarding this: healthy patients not in labor. This recommendation, all this what we were discussing is for healthy patients. Now what does healthy patient mean? There should not be any gastroesophageal reflux disease, gastroparesis as a result of diabetes, and it should not be like post-sleeve gastrectomy surgery. So there is high chances of problem or delayed gastric emptying can happen. So this is particularly for healthy patients without all these problems. Now light meal they have defined as a toast or a cereal with clear liquid. Adults, healthy adults should drink carbohydrate containing clear liquids up to 2 hours prior to surgery. This is important. I want to discuss this thing. Now what they have seen in the so many studies, that if the patient is allowed to take carbohydrate containing drinks 2 hours prior to surgery, the chances of the post-operative insulin resistance, stress and hunger are minimized if the patient is allowed to take this carbohydrate rich drink before the 2 hours before the surgery. So that is the reason they have mentioned it clearly, that they are encouraged to take this carbohydrate containing drinks 2 hours prior to surgery. Now, as far as European Society of Anesthesiology and Intensive Care is concerned, adults 2 hours clear liquid, 6 hours for milk, solid food, and chewing gum and sucking candies allowed up to until induction. Same as that of American protocol. Children's 1 hour clear liquid, 3 hours for breast milk, 4 hours for formula or non-human milk, light breakfast. But in American they have 6 hours for light breakfast. Here 6 hours for other solids. In American 8 hours, but here in European 6 hours for solids. But there is a list of solids, limited solids, that what they say this should be taken. The hours of fasting should be 6 hours. Now comments, they encourage adults to take oral fluids up to 2 hours, and children encourage oral fluid up to until fasting time. Now Australian and New Zealand College of Anaesthetists, for adults 2 hours for clear liquid, 6 hours for limited solids. So there is also a list of limited solids. For children more than 6 months of age, 1 hour for clear liquid, and it should not be more than 3 ml per kg, and 4 hours for breast milk and 6 hours for formula and limited milk. Now for children less than 6 months of age, 1 hour for clear liquid, 3 hours for breast milk and 4 hours for formula milk. So this is about the Australian and New Zealand College of Anaesthetists. Now their comments also, these guidelines are particularly for healthy patients. They mention that is, there should not be any gastroesophageal reflux disease or any other risk factor that will increase the perioperative vomiting or regurgitation, and 400 ml of clear liquid is safe for adult patient. Now Association of Anaesthetists in Great Britain and Ireland, 2 hours for clear liquids, 4 hours for breast milk and 6 hours for solid food formula and cow's milk. They also allow chewing gum up to until the time of induction. Now as far as Canadian Anesthesiologist Society, 1 hour for clear liquid for children, 2 hours for clear liquid for adults, 4 hours for breast milk, 6 hours for solid infant formula non-human milk. So here also 6 hours for solids. Okay. Now comment, they also encourage oral clear liquids up to until fasting time. Now as far as Indian Society of Anesthesiologists is concerned, they allow for adults clear liquid up to 2 hours prior to administration of anesthesia and sedation, and the volume of clear liquid should be less than 450 ml, and non-clear liquid up to 4 hours, and for light meal may be allowed up to 6 hours, and if the patient has consumed heavy meal, it's better to wait for 10 hours. So they have clearly mentioned 10 hours for heavy meal, and heavy meal consumption is not advisable the night prior to surgery. So it is better to not to take heavy meal the night before surgery. It has a strong recommendation. Now as far as OBS patients are concerned, pregnant women requiring sedation or anesthesia should be administered aspiration prophylaxis. That's a very strong recommendation. Now for pediatric patients, consumption of water up to 3 ml per kg until 1 hour prior to administration of anesthesia. Strong recommendation. Consumption of clear liquid other than water, it should be 2 hours of fasting, and the amount should be less than 3 ml per kg. For human milk and fully skimmed non-human milk can be allowed until 4 hours. And for non-clear liquids, light breakfast or light meal may be allowed until 6 hours prior. Now in the last, we have take home message, what we learned from all these recommendations. Now the fatty meal or meat, minimum 8 hours of fasting. For light meal, minimum 6 hours of fasting. For non-human milk and other non-clear liquid, minimum 6 hours of fasting. For clear liquids, minimum 2 hours of fasting. Breast milk, minimum 4 hours of fasting. Chewing gum, better to stop 2 hours prior to anesthesia. But yes, you cannot delay the surgery if the patient has if the patient was taking chewing gum. Now medication, it is better to take medication with a sip of water 2 hours before. Now this was all about the fasting guidelines, and these guidelines particularly for patients who do not have any like gastroesophageal reflux, gastroparesis as a result of diabetes mellitus, post-sleeve gastrectomy patients. So it has to be kept in mind. These are the recommendation for healthy patient without any other problems. So thank you very much. Thanks for listening. If you have any question, if you have any queries, I will be happy to answer.